Hi, good morning, everyone. Welcome to our Facebook Live. Okay, my story Facebook Live. Today, our workshop is going to be oral health care for children with special needs. All right, so today we're going to talk about oral health with children with special needs, and we have our guest, Dr. Ilham. She is a pediatric dentist and special care with UITM. Good morning, doctor.
Hi, good morning, Charlie. Thank you for
Hi.
having me this morning.
Thank you for joining us as well. Okay, so for those who have joined our Facebook Live before, normally I'll start an introduction before we will let Dr. Ilham to share more about oral health care. All right. Okay, so this is our next workshop. Our upcoming workshop is about cerebral palsy. It will be, the guest speaker will be Dr. Mastura. She's a lecturer at UPM, and she is also the vice president for GAPS, Gabungan Anak-Anak Palsy Cerebral. Okay, all right, next. Okay, so about us, Mind Story. So we provide different types of therapies, as well as we cater services to those who have academic delays, sensory delays, developmental delays, behavioral and emotional difficulties, as well as physical delays. Okay, therapies such as academic support, behavior therapy, clinical psychologists, counseling, occupational therapy, reading therapy, speech and language therapy. So we can also screen for children with special needs with clinical psychologists on board. And then from there, we will see what types of therapies needed for the children. Okay, so the overview of the workshop today, it's about oral health, and also we want to know the importance of oral health care among children with special needs. So in general, we do know that dental health or oral health is very important for children, but in this particular workshop, we're going to talk about children with special needs. Okay, and we're going to briefly go through the types of oral professionals, but I won't go through each. Today specifically, we're going to talk about pediatric dentists, which is the specialty of Dr. Ilham, and then the role of pediatric dentists, especially in terms of special care. Okay, so oral health matters, okay, as like I said just now. Overall, oral health is very important for the overall health being. Okay, and oral diseases can cause pain that may lead to other issues like difficulties in eating. Okay, from my experience talking to parents, a lot of sometimes kids with oral sensory or kids experiencing pain, but they could not express. Okay, so this is where it can be something related to oral health. Okay, so we have to plan and make a screening or do some checkup on a yearly basis with your dentist, okay, to know other than oral sensory issue, can it be because of like oral diseases that cause pain to the teeth where the child cannot explain? All right, and the third one is tooth decay of milk teeth. Is more than 530 million children around the world are experiencing this. It's quite common for tooth decay in children. Okay, and most oral health conditions are preventable and are treated in early stages. So I've talked to different types of dentists, but not specifically pediatric dentists. This is my first time meeting a pediatric dentist, which is Dr. Ilham. So what I understand from a common dentist is, a general dentist, is that a lot of oral health conditions are preventable. It's and can be treated in a very early stage. So sometimes if children have difficulties, okay, parents can do it at home. There has a lot of tips on how to start taking care of your child as young as infant, or as young as when they start growing teeth. Okay, so that's where if your child has difficulty to go to the dentist, maybe you can call up or ask any dentist around you about the tips of taking care of a kids as young as infant or as young as when they start growing the first teeth. Okay. Next one, specifically, I want to talk about oral health among children with special needs. So overall, like we have said just now, oral health is very, very important. Okay, and it's one of the aspects of whereby it can lead to different types of physical health. So these are, from my experience working with parents, okay, we hardly talk about oral health as we are very focusing on other symptoms. Okay, for example, if a child with ADHD, we tend to focus on the hyperactivity, the attention span, but we tend to oversight or oversee something like physical health, it's in particularly oral health. Okay, so oral health is oral health among children with special needs. It's something that I came across when I work with the parents. Okay, about if I can, yeah, as early as this year during the MCO. Okay, where we are all at home. This is where parents start to get aware that the child is they have some difficulty in the mouth area. Okay, they talk to the OT, they talk to different types of therapies. Okay, why I said OT is because OT also look at the sensory. They sometimes have talk about oral sensory where they do oral massage, okay, to desensitize or to cater to the seeking behavior of the oral, like teething, biting, okay. But after I met these parents, they've seen OT, they made different types of therapy, and they cannot rule out why is the child is refusing to eat. Okay, this particular child refused to eat and have difficulty in terms of chewing. Okay, and he cries and cries and cries and just drinking milk. So in the end, they decided to send to a dentist, where they found out that actually this child is having gum infection. Okay, so after treating that, then finally the parents found out that, oh, okay, so I oversee the general health, or in particular oral health of my child, because I'm so focused on so many different things in the child that I forgot about that, you know, there's also something called oral health. Okay, so even in Malaysia, research or overseas research, it shows that people with disabilities, any type of disabilities, are likely to have poorer health condition. So it could cross the lifespans of from child to adult, or even geriatric or elderly care. Okay, why? The first that I found out is limited accessibility. Okay, a lot of parents that I work with, especially this year when we talk about oral health, even I myself have really not really well versed in terms of oral health. Okay, we know that if you have something to do with teeth, then you go to a dentist. Okay, but when we talk about children with special needs, so children means pediatric dentist. We have to find pediatric dentist. Okay, and then if with special needs, then you have to find pediatric dentists with, you know, experience with taking care of children with disability. So with that's why it's the first one will be limited accessibility. There's not much of information is being shared around parents, and like especially where do I go? Most of the time, the parents that I met, they prefer private sector of dentists over government. Okay, so whereby if we talk about pediatric dentists in, you know, in private sector, it's quite limited as well. So that's where parents I met are not sure where to go, hence limited accessibility. They don't know where to go, where to find one. Okay, second thing, financial. Like I said, a lot of parents that I met, they have been going to private dentists for, you know, for quite some time. So to work with children with disabilities, it can be from the aspect of financial difficulty, because as we know, dentist in private can be affordable to someone, but it can be expensive for other people. Okay, so that's the things that when I work with parents, I encounter that, they have difficulties financially as well. Okay, the third thing is the complexity of medical conditions. Okay, this one in particularly, I experienced this family whereby the child has neuro development difficulties. Okay, so this child has a lot of medication. Okay, so when this child have a lot of medication and might, when this child is admitted with administered with different kind of medication, so when come to dealing with oral health, there's some medication, or maybe the child has to be sedated. So that's where it becomes complex, because you have to have different doctors to come together. So when the parents explained to me, I was like, and approached me and asked where to find a dentist to work with. Because for me, to be honest, I'm not very well versed in the medical field, because I'm not sure, how is this medication work? How do your child condition work? So that's where I told the parents, I think you have to find someone like what we call a pediatric dentist. Okay, because this child has a tooth decay which quite severe, where the teeth become very small, and and the gum is quite the infection towards the gum is, you can see it's like bleeding and it's red. So, and then when they go to the private or they approach a dentist where with no background of dealing with special needs children with special needs, they immediately turn down the parents, saying that I cannot deal with this. And then the parents become stressed out, like, where do I go? What do I do? Like, the medical condition is so complex that it requires dentists or pediatric dentists that really have experience. Okay, and then the fourth one, why people with disability, or children with special needs have poorer oral health, because the ability to perform oral hygiene. Okay, for example, I've met children with cerebral palsy. Some of them they have club hand. Okay, where they have difficulty holding toothbrush or limited hand movement. So for them to perform oral hygiene like brushing, okay, it's a bit difficult where they require assistance. Okay, so this is what we talk about. You always heard about when you see an OT or see a pediatrician, they talk about daily living skills. Okay, one part of the daily living skill is we call hygiene, self-hygiene. Okay, self-hygiene can be taking shower, cleaning yourself, self-grooming. Another part of it under hygiene is oral hygiene. So the ability to perform oral hygiene is limited. Okay, some child who has we talk about cerebral palsy where they have limited hand movement, and then some child who has sensitivity around oral area. So they tends to be hyperactive. It's too much of a sensation around the mouth that they will avoid. Okay, so by having sensitive gum or teeth because of a sensory issue, by brushing, it just, they just don't like it. They will start, screaming, they'll avoid, start crying, because they just don't like the sensation of brushing on their teeth. And then this is where, hence, with difficulty in performing oral hygiene, hence the oral health of children with special needs is getting, it's likely to be poorer than those children without disabilities. Why? Because it's easier to train. You can have a routine start at a very young age, but it's very different when you have children with special needs. Okay, so these are the four reason why that I personally experience why parents have, children with disability have, or children with special needs have poorer oral health. Okay, I've met a lot of parents over the years where, we so focus on therapies. okay, or TV show, and sometimes we really oversee or overlook something as simple as oral health. Okay, oral health can be simple in the initial stage. As you know, things getting complicated, getting harder. That's where, or the oral health are not well taken care of. That's where the condition can be very poor. Okay, and for me, this year is also an eye opener because um, I've seen more and more cases like this. Okay, and parents started to come to me and asking me about dentist or oral health. Okay, so that's where this is what this is where I talk to parents about where I meet different dentists and talk about types of oral healthcare professional. Okay, so today specifically we're just gonna focus on dentists, especially pediatric dentists with special care. The rest, endodontists, oral pathologists, orthodontists, oral medicine, this is a different type, but they also contribute to the oral health care of a child. But first thing first, I would suggest parents, if you have any health difficulties, just go for a general dentist, either government or private. Okay, and then if your child is, if they cannot deal with your child, then ask for referral. Like, do you know any pediatric dentist or, pediatric dentists that are experienced with children with special needs or special care? Okay, so why? Because this year is, like I said just now, it's an eye opener for me because it's something that I also not very well versed of, whereby oral health is something that I know, but I didn't really go in depth in it. Okay, so when parents approach me, that's where I started to approach different types of dentists just to get information for the parents. Okay, and I also share this with other parents where they can share with me, in the area, how many dentists have experience with children with special needs. So that's where it leads me to find a dentist, which pediatric dentist that has experience with special care. That's where I stumbled upon with Dr. Ilham from UITM. She is a pediatric dentist and she has experience in terms of working with children with special needs. So therefore, I'm very glad that she accepted to join us when we send the invitation for her to run a workshop for us. Okay, so that's why today I'm very happy to have Dr. Ilham here to share with us about like what are the role or the role as a pediatric dentist and what do they do. Okay, so this is where we decided to put it instead of a closed workshop, we make it open, okay, public, so that parents who are interested to know more about dentists, they can just come and then just, we just watch it from a Facebook Live, and also they can share it with anyone else. We want this information to be open, like I said, accessible to everyone. As long as you have Facebook, it's accessible for the information is available, readily available for everyone. Okay, because like I said, dentist is something that we hardly talk about. Okay, so and if we want to be specific, pediatric dentist, even I myself have a difficulty looking for a pediatric dentist until someone recommend me about Dr. Ilham. Okay, so yeah, so parents, so stay tuned with Dr. Ilham sharing. So now I'm going to pass this workshop to Dr. Ilham to share about her experience and to talk more about pediatric dentists. If you have any question, feel free to put it in the comment box and I can share it with Dr. Ilham.
Okay, so it's my turn now, Charlie.
Correct.
Yes. Okay. All right. First and foremost, thank you very much to Mind Story for inviting me, and especially to Charlie for reaching out to me and invite me. It's such an honor for me to come today and speak to all the families and all the Mind Story Facebook parents, therapists, and as well as in public in general. So allow me to share my screen. Okay. Is it clear from your side, Charlie?
Yes.
Okay. Right. Let me start. Okay.
Doctor, I think you need to put in a present format.
Oh, in present. Okay.
Yeah.
Okay. Sorry.
Yeah.
All right. So let me start by introducing where I come from. Okay. So I'm actually a pediatric dentist and special care from University Technology Mara, UITM, where our campus stated in Sungai Buloh. So as you know, UITM is actually the biggest university in Malaysia, where we have 4 branches, and the branches are actually represented all states. So as the bigger universities, we have lots of campuses. So usually we don't stay put at one place. However, for medical and dentistry, we are in campus Sungai Buloh for your information. But for faculty Sains Kesihatan, which is the Allied Health Science, will be in Puncak Alam, campus Puncak Alam. From Sungai Buloh to Puncak Alam is about 20 minutes. And we just launched our our hospital UITM is also in campus Puncak Alam. So these are the introductions of our health providers institution. We have our own hospital now in HUITM. Please do come and visit us if you need any healthcare or consultations. Coming back to myself, let me introduce again myself. My name is Ilham Mokhtar, and I'm a lecturer and a specialist in pediatric dentistry and special care. I'm very blessed that I managed to secure a scholarship from the UITM to study in Belgium, Ghent. So the beauty of my program is actually a pediatric dentistry. However, the whole 4 years I did my training is emphasized in the children with special care, hence the name of the program. However, I'm a gazetted as a pediatric dentist with the government, but I bring that the uniqueness of my program through my specialty, which is the special needs children. So I'm from the Department of Comprehensive Care Studies. As I mentioned, us is in Campus Sungai Buloh. So today, this topic that I've given by Charlie is oral healthcare in children with special healthcare needs. So I'm going to talk a little bit in a general perspective, as Charlie has given his introduction, which is actually that is the gist and the nutshell of oral healthcare needs in children. I think the important is you definitely have to go and see, as Charlie mentions, go and seek the right person within the right institutions that can provide the best for your children. So I'm here today to share with you my a very short stint, I might say, not yet a complete experience, but here I am to share with you what I can. So the topics that we'll be covering today, actually, if it's a face-to-face, it will be a very nice workshop that we can really see each other, and I can show you the demonstration on your patients and on the model, for example. But moving forward, okay, we cannot lose to the pandemic. Now it's changing to endemic. So I hope that today's way of workshop, by sharing some of the photos and some of the ways of I doing things in my how I doing things in my practices, might enlighten a little bit about this topic. So I'm going to cover on the oral health concern, as Charlie had mentioned. There's a lot of concerns actually in terms of oral health care in our children, especially the special needs children, because of their conditions and their disability and the ability itself. Okay, and moving forward, I'm going to emphasize also on the nonverbal signs if our children is having a toothache, because some patients, some children can do really tell, or showing or make some, by telling or by showing things like that. But most of them are actually a nonverbal. So the nonverbal signs, if we can really actually capture it at the early stage, or when the infections or the problems is not it's not in a chronic stage, where it's actually in an acute stage. Perhaps the treatments and the managements can be easier rather than wait until it becomes bigger. And challenges and barriers, I learned a lot actually from all the parents that I've seen, and we improve each other. Even some, like Charlie says, he has tremendous experience with parents. I think in this field, we learn more from the parents. Yeah, parents keep coming, and then, doctor, I think you need to do this. Yeah, I do learn a lot from parents comparing to my, textbook learning from my trainings. When the parents comes and share their thoughts, and why don't you do like this? Why don't you do like this? So I think that's the most valuable that I gain in my practices. And then we go to the toothbrushing activities. Okay, I think this is the key of maintaining good oral hygiene, and we can teach you in our setting. However, we want you to go back and do it at home, because the home care is actually the important part. Because we can see your children maybe 3 monthly or 6 monthly, but on the daily basis, the parents and the caregivers actually at home who are actually providing this more than us. So we are here as a team. My team and the home team has to be a one big cycle synergistic team. So if we can work together, I'm sure that we can achieve more. All right, and I'm going to close it up with providing dental treatment. And I'm sure a lot of children with special healthcare needs have a lot of underlying comorbidities, a lot of medical compromise and complexity. There's some of things, some of things that we need to go, that we need to really go into it and to see whether it's suitable or not to be treated, perhaps pharmacologically, go to GA or sedations, or non-pharmacologically is safer for them. All right. So quickly, let's go to oral health concerns. So there's a lot of concern in our children. It can be, number one, because of medications. If our children are taking multiple medications, we call it polypharmacies. I think the majority, maybe patients with CP has multiple medications that they need to take. For example, phenytoin or some of the medications, the anxiolytic medications, the side effects is actually overgrowth of the gingiva. Even though you brush 3 times a day or perhaps 5 times a day, as long as the medications need to be taken, the oral growth, the gingiva growth will still take place. So these are the things that we have to work together, because we cannot stop the medications. For example, physician says, no, you cannot stop the medications, dentist, but the gingiva keep coming back. So how am I, I have to do my part, and the parents have to do their parts, as the medications cannot be stopped or cannot be tapered or changed. This same goes to the patients who are actually having heart problems. For example, Down syndrome patients. Some of them do have ASD, VSD, corrected, non-corrected, things like that. So they have to have an optimum oral hygiene, because poor oral hygiene can lead to infective endocarditis that can go to their hearts if they have a weak heart. Easy to say. All right. So here, I just want to emphasize, sometimes we overlook that intraorally might lead to a bigger problems. So even though oral cavity is just a small part of our whole body, but it actually is as significant as other parts of our body, where it contributes to the medical condition, the general health of our children. So let's go to the picture. So the first pictures is the most common pictures that we usually see is gingivitis. We call it infections of the gums. As Charlie have mentioned just now, this is quite prevalent, quite evident in our special needs children. Okay, it's either because of the medication I told you just now, and it's also can be caused due to the oral characteristic. Some patients, for example, they have malalignment. They just like misalignment, or maybe the upper jaw is smaller. Sorry, the upper jaw is smaller than the lower jaw. The lower jaw is slightly underdeveloped, or the tooth is bigger for the jaw. For example, the jaw is bigger from the tooth. These are discrepancies that we usually see in special needs children. So having these discrepancies, it's not quite easy to, to clean something that, here and there, up and down, left and right, rotated, tilted, things like that. So some of the parents do come and say to me, especially on the lower part, when they have double tooth, they are like impinging and tilting on each other, it's quite difficult to clean because it's not upright and it's not quite an easy surface to clean. So this is also can be a problem. So this photo here, and this is we call open bite. It can lead from the tongue thrusting. Some patients, some kids do have this kind of habit, especially for the macroglossia, patients who have big tongue. For the children, when they have a big tongue, like try yourself. You know, when you have a tongue, you speak, you eat, everything goes with the tongue. So imagine when you have a bigger tongue than your jaw, where are you going to put and rest your tongue? So you end up putting it upwards and then created this space. So this space will end up with mouth occlusions and then give more problems, and they end up with mouth breather and things like that. Going to the lower picture, so this is the classical of caries. Okay, so caries usually we see on the occlusal surface where we munch, or the we call it the biting surface where we do the kunyahan. But some patients, if you cannot quite attentively brush on the anterior parts, so this is what we call smooth surface caries. Usually, it's something not quite easy to get actually, because caries needs 3 months to develop. So 3 months of not brushing or 3 months of not doing anything. So 3 months is quite a long time for you to initially have a caries. So these are the patterns that we usually see. Okay, coming to the lower pictures is actually a trauma. So CP patients, ASD patients, when they are very, I do see this a lot in ASD patients, because ASD, the autistic children, they have a very high threshold. So they can play around, jump here and there, jump here and there, and then fall down, and then wakes up, bangun balik, and then just continue playing because their pain thresholds are very high. So sometimes we overlook this. Actually, they dah terantuk somewhere dah, but because they don't cry, they don't complain, they keep laughing and then play again. So perhaps this just another day, and maybe that trauma has been there for a long time without we realizing it. Okay, and the next to trauma is actually bruxism. This is usually also happens in CP patients, where awake bruxism or sleep bruxism. Awake bruxism when they are awake during daytime, and sleep bruxism during their sleep time. So sleep bruxism can also be categorized as involuntary because you are sleeping. But when you are awake, in CP patients, it also can be considered as involuntary because of the muscle spasm. Okay, so if we are not quite aware, if we are not like, you know, trying to spend our time looking inside our children's mouth, so these are the things that we might not be aware of. So by the time that they comes to us with this kind of conditions, the tooth is already 1/3. So what much options that we have at that point of time, and you know, the management will be more complicated, incur more cost, for example. So I really you know, emphasize to the parents, always spend a little bit of time, maybe once a month is sufficient, just to go, you know, to play dentist at home, just to check that everything is okay, the tongue is there, the teeth is here, and the, you know, there's no funny business is doing in the oral cavities. Okay, and the other things that we also see is actually patients, especially patients with sensory issues, they always like to bite things. So when they started to bite tables, all the hardwood things, so you might end up having patients who actually we call it an acquired trauma. Instead of jatuh, they bring the thing and then they bite it until they sufficiently. I do have some patients who really like to bite t-shirts until t-shirt dia dah koyak-koyak, and then there's got some patients who like to eat cables. They just want to feel, they have the sensation. As Charlie says, most of the patients who have sensory issues, they feel quite numb. So doing this kind of things, I learned from OT, perhaps is just to get rid of that angry of not feeling that area, so they just have to bite something. So it might end up hurting and injuring the tooth. Okay, so the last one is pika, which is actually eating foreign bodies. So dia makan-makan sampai habis. So it's just not only affecting the tooth, but it's also going to the digestions. All right, so these are, I think, the most important. And yeah, sorry, I forgot about the saliva, about the drooling. So the drooling is something that we usually see, especially in CP patients, and patients do come and we do help in a sense of not to stop the drooling, okay, but to work together, because the drooling not much of a problem on the tooth surface, but it's actually on the soft tissues. So when you have this drooling dia banyak bacteria. So bila banyak bakteria, dia akan jadi infection dekat sini. Alright? And then patient will have angular colitis, tak boleh buka mulut, sakit, tak boleh makan. So these are also some things that we have to look into. Alright. So coming to the next point, I hope that's quite clear. Why is it so important for us, as Charlie mentioned, to really understand what is actually happening inside of our patient's mouth, our children's mouth. So sometimes patients do tell, sometimes, yeah, okay, it's just, you know, perhaps they don't even realize that they are actually having something. So this comes to the nonverbal signs that your child might have a toothache or maybe have something painful inside their mouth, but they don't know quite how to tell you or how to react. Then they started to hurting themselves, for example. So I managed to make this pictogram with my students, okay? So if they started to hurting themselves, some patients, you know, parents, you are the best person to know the daily activities or the behavior of your children when they are happy, when they are stressed, when they want things, when they don't like this, don't like that. So you know the changes, okay? So when you have a child who is actually like, okay, obedient, baik, senyap, they suddenly started to hurting themselves. Okay, so what we learn is when they started hurting themselves, actually they want to take away the pain to somewhere else. I do have patients that bang his head on the wall for many months. Okay, and then, you know, when the parents started going to ortho and then check for the forehead, so it comes back, oh, tak ada apa-apa lah, dia terantuk. But the terantuk are getting more worse by months. So until one time they come to us, I think we were referred, and then come to us, we just need 2 good minutes to open the patient's mouth, and then we see a huge abscess, a rotten tooth on the lower first permanent molars. So that's why they want to hurt. It's actually hurting him here, but I think the referred pain, he just want to get away this pain, he end up hurting his forehead. Hitting others, okay, mood change. You know that sometimes kanak-kanak ada yang dia macam memang happy go lucky je, hari-hari ketawa, hari-hari main. But today suddenly they change. Tak nak main, semua tak nak, tu tak nak, ni tak nak. So then you have to really check. Then we started to check tangan ke, perut ke, ada nak pergi tandas ke, sakit perut ke, is it digestion. Please don't forget to check also inside their mouth, right? And again, biting others is also the same thing. When they want to get, you know, they just don't know where is the sensory comes from. For example, because pain, tooth, I'm not sure, I think most of us have experienced toothache. Some of my patients, sometimes the men, they always say to me, doktor, sakit gigi ni macam lebih teruk pada sakit beranak. I don't know where they get this notion because they haven't been into labors, but they usually comparing sakit gigi sama dengan sakit beranak lah for the men. I'm sorry, men out there, but you know, the painful has to be so agony for the child to bear. Then they started to have this kind of changes of behavior. All right, so isolation. All right, so when you see that your kid is started to isolating and then just go to the corner, minding their own business, whether there is not usually, it's not something that the usual behavior that they do, you might need to check, and they say, you know, try to check what is actually going on. Passive aggressive, sekejap baik, sekejap tak baik, sekejap okay, sekejap tak okay. Especially for the cases for chronic pain, acute pain, dia sakit, lepas tu habis, nangis mungkin 2-3 hari. Tapi kalau chronic pain, dia sakit, lepas tu dia baik sekejap. Lepas tu mungkin 2-3 hari, tiba datang balik sakit tu. So sekejap, that's why the changes is fluctuate. So this is what we call passive aggressive. And of course, long crying. There's an unbearable to the point of no return of crying. So you have to definitely look for something. Tantrum, yeah, I think this is the usual. And then banging their head on the hard surfaces. Okay, so I hope we are still together, and then we'll come to the challenges and barriers in toothbrushing, because at the end of the day, I think the gist, whatever parents tanya I pun, apa sebenarnya, how can I take care of my children's oral hygiene? I have no other answers beside from toothbrushing, okay? Because if we were to go into diet, because I'm sure that Charlie also had planned to call some nutritions, most of the kids is actually picky eater. And when they're picky eater, they tend to eat something very specific. For example, the one type of food that we are not very fond of is actually the sticky ones. the sticky product. So when they eat sticky product, they tend to stick on their tooth longer. So when the toothbrushing, yet again, we come back to the toothbrushing. When the toothbrushing is not optimum, regardless of whatever you eat, it's going to be a bigger problem. Because with picky eater, we don't want to taper down, or we don't want to change. What they want to eat, they have to eat. Otherwise, they're not gaining weight. So we don't want to kacau dia punya dietary so much. Because nasib baik dia nak makan pun nasib baik doktor. So takkan I nak kacau pula. So yet again, something that I cannot kacau is actually toothbrushing. Whatever you eat, whether you like it or not, you have to brush. So again here, I would like to emphasize, it's the best way to do oral care is actually toothbrushing. So here we go. To be able to do toothbrushing optimally at home, we have to understand what is actually the problems, what are the barriers, what are the challenges that why our children doesn't want to be brushed, for example, or perhaps something that we are not aware of. Mungkin kita tak tahu what are the difficulties. So here I'm wanting to share, okay, some of the characteristics or the problems, okay, that we usually face. In fact, in our setting also, we face this, and then we learn together with the parents so that they can continue doing it at home. So number one is easiest. Dia tak nak buka mulut, memang tak nak buka mulut. So when they are negotiating, we have to think of something, all right? So there's no point of negotiating. Tak naklah, tak apalah, kalau tak buka mulut, tak payahlah buat. So you see, these are the things that we have really worked together. Okay, the next photo is dia buka mulut, okay, they manage to open their mouth, okay, brush, tetapi dia tak boleh, sudah, they cannot speak, all right, or they just like playing with the toothpaste rather than, you know, together with you in the activities, just making fun out of it, okay. And then the photo down here is when they cannot gargle. So most of the parents also come to me are quite worried of using the toothpaste when the child cannot speak and gargle. So they kata, bahaya ke tak? Is it dangerous if we were to use fluoridated toothpaste? And some of them get this idea if the child is actually swallowing too much of the fluoride, it can lead to something else, and then they end up not using a fluoridated toothpaste. So fluoridated toothpaste is a key, because we need that fluoride to make the tooth strength, to give the strength to the tooth, to make it harder. So we have to go to fluoridated toothpaste. I'm going to discuss if there is arising matters about this. And then see with the yellow girls, they just run away. Tak boleh doktor, saya buat keluar je perut gigi, piu, dia lari, hilang. Dia tak boleh tahu dah. So how can your child sense that you're going to brush their teeth? So they know actually. So you are going to do something inside their mouth. Otherwise, they're not going to run. Because sometimes orang kata, saya buat keluar je perut gigi, piu, dia dah lari. So they know that what is this all about. Okay. So yeah, again, we have to understand pasal apa dia lari. Or sometimes ada juga parents cakap, doktor, kalau mak buat, kalau I buat as a mother boleh, tapi kalau ayah buat tak boleh. So why ayah? Why ayah cannot do, or why mama can do? Why certain people can do, certain people cannot? So this is where we have to really sit down and then work together. And the other one, you managed to put the toothbrush inside, but they started to bite it. When they started to bite it, you cannot really push it anywhere, and it might end up hurting them and then hurting yourself. It's going to be a tiring process. So these are the things that we don't want to. The moment that you start being tired, brushing the child's teeth, that's the break. That's the moment where you say, okay. So this is going to go down to your list. All right. And then, of course, when you do brushing, it's always crying, splashing there, splashing here. And then, you know, it's such a really unhygienic activities, or maybe you will end up getting very messy. So you say, okay, tak apalah, because, you know, it's too much of a work. 2 minggu sekali je brush gigi. All right. So how are we going to tackle these things? All right, so coming to the toothbrushing activities, how can I suggest, or how I've been practicing with the parents within my practice? So first and foremost, you have to get, when you want to do something, you have to get the paraphernalia, you have to get the instrument correct. For example, I want to extract a back tooth. I cannot use the forceps for the anterior tooth. It might break up. So you see, whatever you want to do, as simple as brushing, as simple as combing the hair, you have to get the right tools. If your child like to use a comb, you cannot use this, you know, the brush, you cannot use the sikat rambut yang tu. So same goes with the brushing. So when you want to choose which brush is suitable for your kids, always bring your kids together in the process. For example, going back to the patients who have actually sensory issues. When we ask, kenapa dia tak nak buka mulut? What is it? So we have to really put it into columns. Does the kid doesn't like the toothbrush? Does the kid doesn't like the things going inside the mouth? Does the kid doesn't like the taste of the toothpaste? Or does the kid really have very hypersensitivity issues of the tooth, for example? So these are the things. Once we understand this, we go and choose the right tools, we can break that kind of reasons. Okay, so in terms of bristle, we have hard bristle, soft bristle, medium bristles. Try to today try to visit your pharmacies or Tesco ke, Giant ke, you go to the aisle where the brushes are. Just go and read the labels. Okay, there is soft, medium, and hard. But nowadays, I think the industry of making toothbrush are really booming. You can see that bamboo, charcoal, macam-macam. So this is where you first learn about your tools. Okay, then we choose the head. We already decide on the bristle. Okay, how are you going to be sure that the bristle is suitable for your child? So I usually test it on the patient first. How are you going to test that this bristles is suitable? Sometimes, kalau lah anak-anak ASD, what I learned from the parents, they usually use brush and pressure to get rid of the sensory. So what they did is they brush on the body, correct? Okay, so I said to the parents, when you want to decide with brush, you have to introduce the brush first. Okay, you beli beberapa, alright, you beli hard, medium, soft, and then you buat you punya, in 1 week you buat training. So first choose, katakanlah you start with soft. You jangan pergi kat gigi terus. You start with the body first because the body has to accept that tools. Okay, so you start on the hands, on the palm. Okay, hari ni kita buat kat tangan je dulu. Okay, besok tangan, pergi pula kat pipi. You see? Alright, so pergi pula kat pipi. Alright, hari ketiga, tangan, pipi, bibir pula. Okay, so buat lagi. Hari keempat, tangan, pipi, bibir, masuk dalam dulu. Go in between of the buccal cheek. Okay, hari kelima, tangan, pipi, bibir, masuk dalam cheek, pergi kat gusi dulu. And then lidah, for example, just to, just bring around the brush here and there. And by the time, we hope that by the time comes, okay, maybe 2-3 minggu of training, kita bawa keluar je that brush, dia dah boleh terus buka mulut, then we start introducing on the tooth surface. That is when I learned from the OT which surfaces yang dia sensitive. So when we manage to overcome that kind of problems, they will accept the bristle and the brush better. Alright? So choose the suitable toothbrush. Certain anak-anak dia ada mulut kecil, ada yang mulut besar. Macam saya cakap tadi, ada macroglossia. Kalau lidah dia besar, kalau lidah dia selalu terbuat keluar, kalau lidah dia pendek. We cannot just simply, choose the size, the size of the head. Ada yang tapered, ada yang diamond, ada yang macam bulat, ada yang sekarang ni macam-macam kan, ada yang 4 segi, rectangular. Okay, you first identify, learn the size of your children's mouth opening. Okay, then you choose which one is right. Sometimes when it's too big, but your child's mouth is too small, you see, it started to hurting here and there rather than actually brushing. Okay, and then we go to the optimum toothpaste. So here photo I share. The first photo is actually for the adults. Okay, kalau kita tengok Oral B, kenapa dia ada indicator color tu? This is actually where the size of the toothpaste should be. Okay, the P size. So when you use this, but I'm not sure whether the cursor is there. And then if it's under 3 years, you just smear it on the toothbrush. And over 3 years, then you can use the size of the toothbrush. Then you ambil 1/3, 2/3 in the middle. Macam ni, you put, so that's the right size. Okay.
Doctor,
yes.
Sorry to disturb you.
Yeah, Charlie.
There's a question. There's someone asking about toothbrush.
Okay.
How about electric toothbrush? Is it suitable for special needs children?
Voila, very good question. Thank you for asking that question. Should I answer now or I answer directly?
Yeah, you can.
Okay. All right. Good. Thank you very much. So, okay, coming to electronic toothbrush, because I do have the slides, coming slides, but it's okay. Let's go to the question first. Okay, my take on electronic toothbrush, you have to actually identify your patients, your children's. Dia suka ke dia tak suka? Again, how can we know that the child is suka ke tak suka? Sama juga, you have to do trainings. So when you buy, you have to be able to tahu bila kita electronic toothbrush, kalau kita tengok kat gambar ni in the photos, is actually in the rounded brush. Why is it rounded brush? Because when we push on button, it goes on the round circular motion. Okay, so when it is a round circular motion, when you put it on the tooth surface, okay, you don't have to brush anymore because it's already doing it for you. But if you put the brush and then you do it again with your hands, it's going to be double the work. So it will give more sometimes vibrating feelings. So I do have patients who actually doesn't like that vibrations. Okay, I do have patients who actually likes that vibrations, but doesn't like that circular motions. So again, it's not that suitable or not suitable. You can try buy it and then train with your child. If your child can accept it, as simple as vibration tu, you jangan letak brush dulu. You kena practice vibration tu dulu. Especially for CP patients, they're quite easily triggered with vibration, lights and something like that. You might trigger their epileptic, correct? So kalau you dah try, patients is okay, then you try the brush. So you have to training two things, the vibrations and the brush. Okay, so I think let me go to the slides, and then perhaps if you have more question about this electronic toothbrush, then you can ask again. Okay, I hope I answer your question at this point of time. Right, so coming to toothbrushing chain. So why I say chain? Because it has to be, when it can go left side and it can always come back to the right side. Sorry, right side and left side. Okay, what we want to achieve is going to the right side. So we always start with provide. Until when we have to provide to our child? It depends on your children's punya ability and disability. Okay, so but first and foremost, we have to provide. Samalah macam bagi makan, sikat rambut, pergi tandas. Everybody have, semua orang kena go through the process of training. Macam kita pun juga kan, kita tak born pandai tahu pergi tandas sendiri. So kita kena mak ajar, okay macam ni. So provide. So you have to be able to provide to your child's oral health care. I will show you how. When we have achieved the provide, okay, then we involve them. We have to invite them to be in the process together. It calls assisted toothbrushing. Do together. Take your child's hand, hold the toothbrush and then put it there and then do it together. Hari ni practice lagi, besok practice lagi. 1 week practice, 2 weeks. Slowly you start to lift your hand behind. Macam kita ajar macam mana naik basikal. Mula-mula kita pegang kan, okay, kayu. Lepas tu lama-lama kita lepas sikit-sikit, the same things. Alright? And of course, what we want to achieve is actually self-brushing. So these are the chain. Sometimes hari ni dia moody. Dia tak nak, macam just simply tak nak berus gigi. Then we provide. Tapi hari ni dia rasa macam, okay, hari ni semangat. Kat sekolah best. Cikgu ajar brushing hari ni. So dia pun semangat nak buat sendiri. Let them. Okay? Don't discount their effort. Katakanlah macam, you tak puas hati tengok macam, masih lagi ada. But it's okay. For the day, that's it. Esok pula you boleh provide things like that. So that is why I put it in the chain manners. You cannot, you might end up here and then patah balik. Alright, that's the process of it. Okay, coming to toothbrush modification, I really like the way that Charlie put it, that sometimes for CP patients, when they have these flex hands, the ability of holding the toothbrush, because we still have a very, a toothbrush for special needs are very small markets. So they're not quite really, putting in the market because not sufficient people are buying it. So they're not making money out of it. So we have to be creative. So me and my team do comes up. And I think a lot of clinics also are doing this. So you find something that is suitable and you have to first learn about the hands of your children. So I do like to advise about handle bicycle, but get the handle bicycle with the texture so that they can really, appreciate the grasp. Sometimes kids who have sensory issues on the palm, they cannot really appreciate of grasping. Or kalau patients yang pinset, kita panggil pinset grasp, semua benda pun pegang pinset. Ambil benda pun pinset. So macam mana nak pegang berus gigi, it's not going to be steady. Okay, so we have to teach them first. So for patients who are actually having problems with holding of the toothbrush, training of holding the toothbrush is number one. Rather than, so mungkin kita provide lama sebulan sebab kita training dia untuk pegang toothbrush dulu pun boleh. Or you buy two sets. The one that they have to train to brush, the toothbrush that they have to train to pegang, let them pegang, but at the same time you are doing it with the other toothbrush. So you see, then it's just to give that the idea of, okay abang, lepas ni you have to do it, started to do it yourselves. Alright. So beside from handle toothbrush, kita pakai kentuala biasa je. Alright, so just any good morning towels can do. Alright, you just wrap it up and then ikat dengan getah. I like this one because it's kain kan. Lepas you dah habis basuh semua, you boleh cuci and then jemur. Besok balik. So in terms of hygiene, in terms of taking care, keringkan, it's very easy. Okay, another one, kalau yang anak yang memang tangan quite stiff, kita boleh bagi bola tenis. Sometimes what we want to achieve is this. Sometimes mungkin orang boleh kata dia tak optimum pun kot, sebab kalau pegang macam ni kan, how much manual pun yang kita boleh achieve. But at the end of the day, the goal is just to get them to be in the activity of brushing. Kalau by holding the toothbrush, dia boleh buat gigi depan je, tak apalah. Dia buat gigi depan, you provide gigi belakang. Oh hari ni dia nak buat gigi belakang. Then the thing is, maybe they're not going to achieve an optimum toothbrush with this kind of modification, but something is actually something. All right. So the last two photos is actually we use our compound. Compound ini bahan yang moldable, malleable. Kita letak dalam air panas dan dia boleh berubah bentuk. So this is actually a compound materials that we use to make a dentures in our setting. So we try to be creative and then we use this to get the indentations of the patient's hand. So we put it in the air panas. Patient datang kat kita bawa brus gigi dia. Lepas tu kita melabelkan, buat and then let the patients go back with that kind of brush for them to practice. Okay. So this is also can be done using plasticine. Tapi plasticine lepas tu you kena blow dry sebab plasticine dia ada water. So nanti bila dia kena water, dia change of the sizes lah. This is the comments that I get. So lepas kalau pakai plasticine, you kena blow dry dia. Okay. All right. This is the specific tools that I really like to share with you guys today. Okay. So the first toothbrush that I found is the Dr. Barman's toothbrush. This is actually in the market. In Malaysia, somehow I only found one suppliers. However, if you go to a random pharmacy, you can actually found, but they are not quite easily available. Sometimes you have to order. Okay, you have to order. So what's the good things about this toothbrush is actually we call it three-headed toothbrush. They have three brush rather than one brush. Okay, so why is it important? When you have a limitation of time, limitation of mouth opening, your patient, your children's, everything semua nak kena cepat. We don't have that kind good 2 minutes of brushing. Dan bila doktor cakap, you have to brush in 2 minutes, Doctor, I can only have 30 seconds. I cannot. In 2 minutes, that's too long. That's privilege for me. So what can this brush do is actually, instead of, kita akan always kan kalau kita suruh you buat, luar, atas, dalam. So you have to brush on the outer side and then on the occlusal side where you bite your food, and then the inner part where is the most agony because there's the tongue and sebagainya. So with this brush, you just put it on the surface as you see in the pictures. The three brushes will do the job for you in a one stroke. So you don't have to do all this manual dexterity, manual maneuvers. Just put it and then you brush. So only dengan satu satah saja, the brushes will do the job for you in one go. Okay, coming to an electronic toothbrush, I want to introduce here two types. So the first type is your Oral-B, dia bulat, so it goes on the circular motions as I mentioned before. But another one is Systema, they vibrate dia vibrate saja, dia tidak bergerak, they are not moving. So it's just a toothbrush that vibrates. I do also like this one because I still want the children learn on the manual dexterity. Okay, because selain daripada give exercises for their joints, to their hands, and actually giving that vibrations is actually really encouraged on the desensitizations. But that part, you still have to use it. So we get to, killing two birds in one stone, all right? And the heads is smaller. Can you imagine? If you imagine, that's why when I put it next to each other, the Systema is actually smaller than the Oral-B one. So this one is actually distributed by a Lion. This is also needs to buy from a supplier. So anybody who are interested can contact me. I do have this. I bought this through suppliers and I resell. Okay. And this is a tongue brush. Okay. For some patients who actually, contoh yang ada masalah halitosis, dia kata, doctor, I've already brushed my son's teeth or my daughter's teeth 3 times a day, but there is still smell coming out from it. So I don't see any cavities, I don't see any caries, but there is this smells. So usually patients who actually have a rough tongue or macroglossia, again, a big tongue, where they have a lot of philia on top of it. So the foods are highly likely to embedded on the tongue rather on the tooth surface, because when the tongue is too big, the perimeters of the tongues are bigger, so foods are more impact on the tongue. So that when you did not brush it, when you just allow it to leave it there, for example, milk, it becomes spoiled, and then they started to give the smells, foul smell. Sorry. So these are some of the tools that you can use extra for your children. All right. So coming to toothbrushing positions. I think this is one that I really like to learn and teach to my parents, because sometimes tak boleh, doctor, I've tried, saya pun dah sakit belakang, I'm getting old, but I cannot do this. So maybe it's just the position, because when we are brushing, when we have to provide, of course, our body position and posture is more important, because we want to do this on daily basis. All right, if we, I do, to get frustrated, tired, it's easy when you have to provide to someone, right? And then they are getting bigger. Masa dia kecil-kecil, bolehlah kita pegang. It's easy for us to hold and then, pin them down, things like that. But when they are getting bigger and bigger, we are getting smaller and smaller. So we have to be, have to be onto how can we continue on doing these activities, and it's supposed to be a fun activities. So some of the positions that I can share today, especially for patients who are actually jerking, always wants to run away. So we wrap it up, we wrap them down and then put it on the chair. The key is you have to have 2 good hands with you to work. So one hand is to support the jaw, because otherwise they keep on bringing here and there, and then they bring it down. You cannot really brush, and then you might end up injure the lip or the floor of the mouth rather than brushing the tooth. So that lepas tu semua orang macam frustrated, then bye-bye, tak habis. Okay. So if the child are more comfortable on the floor, for example, I mean, the idea of wrapping is to get that, good 2 minutes, maybe not 2 minutes, maybe good 60 seconds. All right. Just to really quickly brush. Okay. So if the child is actually, you can put in the middle of your kangkang. Okay. And then brush. Yet again, if you're aware, in all my photos, you have to support the jaw so that dia tidak ke bawah, dia tidak ke atas. You have to be able to see, visualize what you are working with. Otherwise, terjolok, nanti kan tegak, terkena sana, terkena sini. So, you yourself have to be comfortable as well as your children. Okay? So, katakanlah masa mandi. Masa mandi, dia paling behave sekali. Dia paling suka air. So, put it in the bathtub. Grab that opportunity to use it in the, to do the brushing in the bathtub, for example. For small kids, I say, because they're active kan, so letak dalam baldi. Letak di dalam baldi so that they have very limited way of moving or run away. So that's the place, that's the time, the best time for you to do the brushing. And of course, for me, gadget is key. I'm so sorry, pediatrics. Sometimes pediatrics says don't use gadgets, but for me, yeah, gadgets is to go to tools to help me to at least to get that good 2 minutes to do brushing. All right, so optimum toothbrushing, all right, this is very important because it's easy for me to say, okay, balik brush gigi, balik brush gigi. But bila balik, when you want to try, and then when you brush the wrong thing, that is started goes wrong, things goes wrong. And then everybody macam, serabut lah, sakit situ lah, tak suka sini. Okay, so here is, I think, the one and that I really want to share. So if you want to brush on the upper parts, the very important is lift up the lid. Okay, you have to be able to see everything that you brush. Try not to like macam, okay, macam kalau kita sometimes kita nak cepat pergi kerja pun kan, kita pun macam brush je, thinking sekejap lagi nak pakai baju apa. You might end up miss some points, correct? So same goes when you are providing with someone. You have to be able to see and appreciate. Then you manage, then you get that optimum. So always lift up the lid. So I did this sketching. It's actually me myself doing it on my daughter, and then the illustrator illustrate it for me because I want it to be a real, something yang bukan I buat-buat. It's actually something that I can do. So all of us have the same 10 fingers. I use just my 10 fingers. So with all these 10 fingers, I did this illustration. So I really hope that we can start practicing doing it so that we can appreciate the brushing activities together with our children. Okay, so the tricky part is always the lower ones. So kalau lah anak kita, that's why we have to identify first masa kita buat desensitizing. Kalau dia upper lip dia yang sensitif, so you brush upper lip dulu. So that bila you buat macam ni, dia tak rasa sakit or dia tak rasa irritated. Okay, sebab sometimes bila dia sensitif yang bawah, when they have sensitivity of the lip, you cannot be able to do this. Nanti dia akan lawan balik. So it's going to make things like complicated. So do the desensitization first because it's important. Then you can work with the lip and the cheek. They will work, the cheeks and the lip will work with you rather than, making things complicated for you. Okay, so come to the posterior teeth. You definitely have to break the cheek out. Okay, bring the cheek out. So work with your other hands to break it. So katakanlah macam parents kata, doktor nanti kena gigit lah jari saya, habislah. Betul, saya pun kena gigit juga when I do the training. So later on I will show you how to get not to be bitten. Okay, so you brush atas, always have to lift up. Alright. Okay, another way that yang kata macam mana kita tak nak kena gigit. Alright, so what I did is suruh diorang beli ice cream. Anak lain makan ice cream tu, you collect all the batang ice cream, put it together and then wrap it with gauze. So you letak one side, you put it on the one side, you have, then let them bite. Kalau dia bite kuat macam mana pun, it's not going to be, sufficiently bite on your fingers. So you can really, take your time, work on the other side, and then you change side. Okay, so this techniques also can help kalau anak-anak cannot speak and gargle, so that all the debris of the toothpaste will goes to the gauze and then you change the gauze. Okay, gauze kan dia disposable, beli yang disposable punya, or you can also use macam ni, kita pakai chopstick, ikat dengan kain, lepas tu getah. So you do the same thing, but all the debris, air semua lekat you can wipe it up towards the end with your kain dengan chopstick tu, and then basuh kain, esok guna lagi. Ekonomi, itu yang ekonomi punya. Kalau tak, you can buy gauze, then you change the gauze every time you want to do the activities. This is actually batang ice cream. Ataupun you can ask tongue depressor. I rasa I pergi pharmacy, nampak dia orang dah jual tongue depressor. Ataupun boleh minta lah whenever you go to clinics. You can come to my clinic, I can give, no problem. For free, for sure. So that you can use it at home. Okay? Alright, the other way is to get them kendiri. As much as we can help them, until one time we have to be able to let them go and then do it themselves. So I do found that visual helps. Okay, this is not only works with ASD, lots of other children also can really relate with the visual help. So kita kena letak dia punya sequence. Okay, so satu, get toothbrush. As simple as just to get toothbrush, nanti dia ambil toothbrush adik dia pula. Okay, to make sure that they take the right toothbrush. Okay, or you put at the very specific place so that they know that it's their toothbrush. Brings toothbrush, so when we put in the sequence, so they will go one, and then next, and then put toothpaste, and then brush, and then get drink goggles. Maybe that day you are quite tired, you have to, other areas to attend to. Okay, hari ni you do it yourself, follow the sequence. So the best when you want to do visual help is actually taking your own photos. So I do encourage parents who come to my clinics, they have to have a storybook. Come to Dr Ilham, for example. So daripada pintu depan, I suruh ambil gambar I, take my photos, take my assistant photos, take my chair. So when they want to come next visit, to avoid all this, karate, silat dan drama, they have to learn first, desensitize things from rumah. So dia tengok daripada pintu lagi, dia dah tahu dah. Sekejap lagi, they will come to me. Okay, so I really, I think the visual helps in terms not only for brushing, for whatever things that you want to introduce to your children is very, very much helpful. Termasuk potty train juga. Okay. But the best is to use your own photo. Then they can relate. Macam, it's mine. It's mine, kan? My photo and my real photo, my real toothbrush, rather than cartoonized. But yes, cartoonized do help. But I allow. parents who wants to take photos in my clinic and then make their own storybook. Okay, last, and I think this is coming towards to an end. So providing dental treatment for children with special healthcare needs. So for me, from my part, I really have to understand. Usually, the first visit is just to get them get to know my children. Okay, so get to know macam how I'm going to get to know my children. Kena tahu dia punya ability and disability. Cannot discount anything. So I observe. I will try to speak to them. If they are non-verbal, try to understand their gesture. Sejuk ke, panas ke, you suka ke lampu ni? Like, what do you want to see? Usually the non-verbals are very curious. They are very curious cat. They want to touch everything. So let them. The first visit usually for me to get to know them, and they have to be open up with me, because intervention comes later, needs a lot of effort. So the first few visits is actually getting to know people around you, and they have to feel that they are in the comfort zone. Macam dekat rumah, so that they can be themselves, and it's easier for us to mimic and replicate whatever the best behavior dekat rumah, bring it to the clinic. Okay, so this is I made myself throughout my practices. So I put it in the bahasa because I am coming up with a buku, but the buku is not published yet, so I snapshot yang ni. So usually kita bahagikan kepada keadaan kanak-kanak tu lah, the conditions of their children. Boleh bagi kerjasama, tak boleh bagi kerjasama yang pendek. Macam mana kita nak quantify? So we put it into durasi membuka mulut. How long that your child can open their mouth. Okay, 5 hingga 10 minit. That is a super privilege. I'm a happy camper if my child can open mouth for 5 to 10 minutes for me to do something. Okay, if 5 to 10 minutes, we can do treatments on chair, no problem. We can do scaling, we can do filling, we can cabut gigi, boleh. Okay. So, but we work by 5 to 10 minutes every single time. For example, I give it an example macam nak cabut gigi, to do extraction. Okay, so first extraction, buka mulut. Okay, check gigi, settle, 2 minit. Okay, rehat. Alright, rest. And then nak bagi injection. Okay, 1 minute injection. Okay, dia pun buka, 1 minute, ping, okay, habis. Alright, sometimes I use the kitchen punya oven yang timer tu. Okay, so that thing habis. Okay, dah bagi LA. Lepas tu dia pun bambling, tanya lagi, borak-borak. Okay, it's about time for do the extraction. 2 minutes. Okay, or maybe less sebab dah kebaskan. So we go and then cabut. So usually 5 to 10 minutes is going to siap. It's not that the 5 to 10 minutes buka mulut it's very difficult lah. Usually they won't allow us to do that. Kita pun kan kalau buka mulut 5 to 10 minutes pun dah start kering dah start macam lama lagi ke doktor ni kan. So what more with the special needs children. So if 2 to 5 minutes boleh, we still can use. We can still do scaling, but we do it in the stages. So we divided the mouth into 4 quadrants. 1, 2, 3, 4. So today kita buat first quadrant dulu. Okay, so next visit kita buat second quadrant, third visit, fourth visit. I do sometimes allow that to happen just to desensitize. Okay, and then in 3 months kita buat 2 pula. In 6 months, then baru kita mungkin boleh buat sekali duduk, 1 mulut cuci. Alright, so these are the how I learn and desensitize my patients. Kalau pendek 2 hingga 3 minit, so what are the things kita boleh letak tampalan sementara dulu. We put temporization and then we observe. Okay, the moment that the patients become stable, longer mouth can open, change the temporary to permanent. Voila, on chair. Okay, so if we have done all this, but patients still cannot open their mouth less than 1 minute or with struggle. Okay, so the best is actually to go to general anesthesia. In UITM, we do have this privilege because we have our own OT. We work together closely with medical counterparts. And now we are moving to HUITM, our hospital. Otherwise, we do it here because this is dental. I'm in office. Next door, belakang ni medical je. So we just work together. But now we have the hospital, so everybody goes to the hospital from now. We do have general anesthesia. Okay, you can come. At this point of time, all patients have to do COVID test. One parent can go in, also needs to do COVID test. And then admitted, have to admit lah because of the SOP. And then we do it in the 1 day. And then if everything's okay, can go back the next day. Or if everything's super duper okay, can also go back on the same day. All right. So that is for general anesthesia. The other things, the pharmacological way of treating for patients, we also use sedation gas. I will show you the device in the next slide. And we do also have a pappus board. It is a protective immobilization device. I will show you the photo. And then we do a lot of behavior changes. So how I put it here in teknik pengawalan ni, first is always the best part. I mean, it really needs a lot of effort and hard work, but it pays. I mean, it gives you more satisfaction, even though patients have to come many times. But you don't have to administer drugs. You don't have to do, masuk sini, masuk sana, all this IV line, even though it's the hardest work. But for me, it is more satisfaction. All right. And then we go to sedation, for example. Sedation is just an inhalation gas, bukan yang IV sedations. IV sedations need to go to the hospital. Same procedures untuk general anesthesia. Gas sedasi ni adalah hanya inhalation sedation sahaja. So patients still aware. They still can cry, they still can listen to you. It's just that to make their mood calm and then less agitated and less aggressive. Okay, that's how inhalation sedation gas works. And then on top of it, we can also top up using the device. Let me just show you the photo. So this is a protective stabilization. We call it the pappus board. Okay, I bought it from the American. Only the Americans sell this because they created it. It comes from the word pappus of the Red Indian. If you can Google it, pappus board, the first photos comes up on your Google is actually a Red Indian. How Red Indian hold and bring their babies throughout when they are doing work and doing things, doing errands. So how this work is actually, all right, next photos. It comes in these 4 flaps, the head flaps, the upper trunk flaps, middle flaps, and the feet flaps, the foot part. Okay, so usually the head parts ni kita jarang-jarang guna lah, but we do use if patients are very, for example, emergency cases, macam trauma, split tongue, for example, we need to do that suturing and then patients, for example, have a one fractured tooth ataupun only one abscess, GA, mungkin patients are not suitable to go to GA or GA turn macam 2-3 minggu lagi ke, so we can do at that point of time. Then we use head strap lah to because most of the time patients are actually in pain, in acute pain, so kita nak pujuk macam mana lagi. So these are the device that we used. Okay, so these are the photos. All right, how we use. We can also, we don't have to wrap all the flaps. Sometimes when patients have a stronger ability on the upper part, we just strap on the upper part. That's why it is separated. It doesn't mean that you have to close all the flaps. It depends on the situation. Okay, and nitrous oxygen, we do have this inhalation sedation gas. Sometimes we do combine. So I put pappus board on the child and also give gases. Okay, so gases is actually nitrous oxide and oxygen. Patients can still breathe. We still have to maintain our borak-borak, chit-chat. They still can, communicate with you, but it's just to reduce the anxiousness, the anxiety, to control the jerky movement, to control the environment, to make it safer. For example, if you have to do suturing, we don't want that the hands are waving around, so it might be more dangerous for them rather than for us. So the safety is number one. The safety of the patients is number one. So that's why I do use a lot of this pappus board. And then the general anesthesia. If all have tried of all the methods that we have tried, but to no avail, and we do push patients for general anesthesia. And we have to follow a strict anesthesia assessment. So we send patients a month before for an assessment to make sure that your child is actually fit, and then the side effects or things like that, certain things that we are aware of, contoh epileptic patients who actually have problems with COPD, things like that, the anesthesia will decide. If the anesthesia says go, then it's go. If they says no go, then no go. Okay. And I would like to emphasize on the sustainability of the team. So I'm not working alone, not only 2, not only 3, but we are working with 5 sometimes, and 4 to be honest. So I do have my postgraduate with me. I have colleagues. This is Dr. Afiq. This is I'm very proud of Noor. This is my patient. He is a mild to moderate ASD. We did an endomolar. You see the posterior back, but we did a endodontic treatment, which needs for him to stay still and cooperative for minimum of 1 hour. So we use combinations, a lot of behavior management, and Dr. Afi is communicating well with him. And then I'm just there being a chatty catty just to make sure that no is calm. And then we use Papu's board, and he endured it very bravely and very well. Okay, so the sustainability of the team is a key for me, for us in UITM Faculty of Dentistry to work together in treating, giving the best for our patients. So the importance of oral health care, I think this is coming to an end. Why is it so important? I've been discussing. I mean, I had a privilege have a dry run with Charlie, but it end up as 1 hour. So we did discuss, why is it so important, Charlie? How can we tell and share with the parents about the oral health care? I do understand that sometimes, you know, sending them to school, getting them to be socialized is important, but I think oral health care is as important as the rest. But why? Because it gives the general health, as I mentioned before. If anything happens in the mouth, definitely it will affect. Because whatever goes to your mouth goes to your stomach. It goes to all the bloodstream. So we cannot deny that whatever goes to your mouth becomes you. So you, the general health, is started from your mouth. Okay, so optimum eating is very important, because I do have patients who are actually losing weight and getting a lot of other sorts of problems medically because they're not eating well, balanced diet, because they can just enjoy the food. Certain food they cannot eat because they have toothache. They cannot enjoy protein. They cannot enjoy carbohydrates. So only eat like bland food and then a pureed food. So there's not much of nutrient from the pureed food. Okay, digestion. So if you're not eating well, you're not digesting. So patients always come back sakit perut, have to do endoscopy, blah, 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 make things more complicated. All right. So I want to emphasize that having a good set of teeth, upper and lower, is actually can make a lot of difference on the other parts of the body. Gaining substantial weight from the balanced diet, yes. Positive behaviors, because sometimes I do come across lots of times parents who are not sleeping well at night because they kata anak I ni malam je dia bangun. Because malam when the temperature changes, it gives you that coldness. Biasanya gigi ni when dia dah buka besar, when it already a big cavities. Sebab tu sometimes kita kata kalau you datang kat klinik, I kena air sejuk dia sakit, I kena air panas dia sakit. The changes of temperature. So that's why when malam the temperature drops, gigi started to give you problems. Or when you are not busy, the kids during daytime, lots of activity jumping here and there, they're not really quite attentive to what is actually happening to their body. But when they want started to sleep, want to get rest, then it starts to give them like macam, what is these sensations? Then they're not going to be able to sleep at night time. And of course, dia akan ketuk pintu you. Semua orang tak boleh tidur. I tak boleh tidur, semua orang tak boleh tidur. Things like that. So again, positive behaviors leads to good night sleeps if there is no problem with the oral. Optimum oral health quality related of life, yet again, I cannot emphasize, is always correlated from the bottom to top. Okay, and a stable family function. I do come across parents who are actually having trouble at the end of the day. I'm sorry if I were to say this, like blaming each other, feeling guilty. We do actually make a study out of this, the feeling guilty and the family function for children with special needs who undergone general anesthesia. And we do learn a lot from the outcome. And I do really see that this is actually something that very important that we have to come across and then really discuss it down. So I put this one photo of my patients. It's quite very sad, and it tore my heart when he comes to us with this kind of conditions and not showing any effort and motivations. So we are the only one who's, we try to give as much as options, but there's no two-way communications from the other side. So it's quite sad and at the same time daunting, because we really want to help, but we have to be in the same team. We can do as much, and definitely the parents have to come in and support us, to support them to maintain and sustainable. Okay, so take home message, don't give up. Let's try again and again, and let's do it together. If you don't try, you don't know how much ability, how capable you are. Okay, so I'm just going to introduce a little bit of our faculty, because Charlie pun cakap kat mana kita ni. Maybe patients wants to come. We are in campus Sungai Buloh. So for special needs dentistry, all right, I want to make things clear. special need pediatric is 0 to 16 in Malaysia. So if your children, regardless, normal or special needs children, you seek pediatric dentistry, okay, 0 to 16, regardless private or university or KKM, we hold the same because it's a national age limit, pediatric 16. After 16, we go to special care dentistry. In Malaysia, we are very privileged. Now it's actually a booming specialties. I think we have almost 10 to 12 specialists who actually catered the special needs. After 16, usually kids akan discharge regardless. Hari ni birthday, besok tak boleh datang dah. That's the system works because of the workload burden. So after the 16th birthday, you seek for special care dentistry. There is in KKM, I think in Perak, KL, Klang Valley, we are very fortunate. Kita ada dekat Kajang dengan ada Serdang, ada HKL. Dekat Sabah ada, Perak, Kelantan, okay. So the thing is, when you go to Google, you have to put the right terms for you to be able to come to the right person, okay. So again, 0 to 16, pediatric dentistry, 16 and above, special care dentistry, okay. So we are healthcare providers, kita ada bagi 4 lah. Universities, okay, KKM, private dengan MINDEF, Army. The Army also have their healthcare system, okay. Civilians boleh pergi juga klinik dekat Army. MINDEF kalau klinik dekat Army dekat UTM tu, kat Jalan Semarak, okay. So kalau universities, anything that come across pediatric 0 to 16, regardless special ke, tak special ke, macam mana pun, as long as their children 16 boleh pergi. So university, kalau dekat Malaysia ni, university yang ada dental school, all universities who have dental school, kita ada 13. Okay, private or public health, public and private. So to name a few, kalau kita kat sini, UITM, UKM, USM dekat Kelantan, UPM tak ada, UPM tak ada dental school. Mahsa, Segi, MSU baru nak buka, Masa, USIN, UIA dekat Kuantan. So as long as when you Google, you look for universities with dental school, mesti akan ada. All dental school ada service for dentistry. The privilege for universities because we are teaching premises. So when we do teaching, we have all the specialties. So most of the specialties are available in dental school. For KKM, biasanya kalau you pergi klinik kesihatan biasa, dia akan refer you to the designated hospital. Here in a klinik kesihatan, the system is you have to go to klinik kesihatan first. Okay, klinik kesihatan contoh macam kat sini Sungai Buloh. You go to klinik kesihatan Sungai Buloh, dia akan check, dia akan buat referral to hospital yang ada pergigian kanak-kanak. Specifically near to your compound. Okay, so katakanlah you duduk sini Sungai Buloh tutup untuk COVID buat sementara waktu, you can go to Shah Alam for example. Dia akan refer you. Selayang pun dah started hybrid dah. So first go to klinik kesihatan dulu if you want to go under KKM punya facilities. Then the KKM will refer to you to which specialty. Kalau private you can walk in. Lots of private juga yang dah sekarang ni pun booming lah for to cater for special care children or special care individuals. Okay. And then MINDEF lah, MINDEF ada beberapa yang Jalan Semarak tu, they do have ortodontic pun ada. Okay, so this is my place. I just want to show off because they choose my clinic photos to go on newspaper. Okay, so here I am. So here in the Faculty of Dentistry UITM, we cater from 0 to geriatric. So 0 to 16, we go to pediatric dentistry, and 16 and above for the special care. We do have our specialists in special care dentistry specifically, and we have a unit to cater that. So this, we have our designated waiting area for the special care patients so that we don't really campur lah. Sometimes parents kan dia quite concerned kalau nak tunggu lama anak-anak dia tak tahan, nanti dia kacau orang sana, cubit sana kan. So we do have our designated area for our patients. And these two surgeries, the Tweety Bird is my surgeries, is a flat chair, and then this my colleague surgery for the adults one. So we do have hoist. For example, not transfer patients from the wheelchair to the Bariko chair. This Bariko chair is actually the can sustain 300 kilograms. Okay, the biggest patients that we have. All right, so everybody is welcome. You can email me For example, if you want to come in for consultation, for example, ask question, or just to have a chat, don't hesitate. You can call me at ilham@uitm.edu.my. I will try my best to go through. And then even if you are interested to come and have a consultation with us, you can email me and then I will arrange with my assistant. All right, that's it, Charlie. Thank you everyone for listening.
All right, thank you, Doctor. That's a very interesting presentation. Okay, all right, so now it's time for some Q&A. We have, I myself have a lot of questions I've collected over the years, but let's go through those who has asked in the comment box. Okay, so one of them asked, what would be the fees or range of fees can parents expect for a regular visit?
Okay, let me answer for UITM first, because we are universities, kan kita badan berkanun. So please make sure that your child have OKU card. OKU card tu is a magic card. You can go anywhere with that card and seek a lots of privilege from there. So if you have an OKU card for us, I'm speaking for my facilities. Usually it's free. Okay, only for certain cases. For example, macam dentures, things that you have to go to the lab fabricating, then you have only to pay for the material fees. Okay, if go to the hospitals, the daily rate for hospitals less than 100. So again, the OKU card is a magic card whenever you want to go to facilities. For governments also, the OKU cards is applicable, but for private, I'm keeping my comments, because some private do have certain fees, and they do also entertain for insurance, waive insurance waiver. But for us in UITM, the OKU card can really help you into getting all the discounts.
So let's say a child without OKU card, how much would it be, like the range of the costs when they go for UITM clinic?
Okay, for UITM is more or less, because kita dah ada akta fee dekat Malaysia, akta fee untuk private, untuk treatment, sama ada government treatment or private treatment. So it will be range, for example, pick a treatment, tampalan. It can range between 100 to 200 ringgit, somewhere there. Government, kalau government you daftar RM1 je. Kalau kanak-kanak also waive. Kalau kanak-kanak regardless. Tapi kalau university, because kita badan berkanun, so treatment has to pay, but a very minimal amount. Kalau private, that it can go shoot up to 100 to 200 lah. Kalau kanak-kanak dekat sini, contoh macam tampalan macam tu, 30, 50 ringgit. And then in university, we are very privileged because we have, first, kita ada dental student, undergraduate, kita ada postgraduate, kita ada officer, kita ada pakar, kita ada 4 lapisan. So these 4 different peoples, they impose different fees. If you're being seen by the dental undergraduates, free, regardless, except for things that you need to fabricate, macam denture tadi lah, that you have to pay the materials. And then postgraduate, and then officer, they have their fees. So it goes up lah. When you come to specialists, it goes up. But yet again, I cannot emphasize to have OKU card. It really is a magic card whenever you go to healthcare facilities.
Okay. All right. So everyone else, if you have any question, feel free to put in the comment, because I'll keep my question to later. I prioritize for those who attend first. Okay. All right. How do I take photos of the teeth? If I can't bring my kid to the dentist, at least I can show them the image and see if they are able to help him.
Yeah. All right. Yeah, we are also, since of the COVID, we are moving to teledentistry too, because patients sometimes cannot come, and then their fear of exposing to COVID. Yes, some patients do contact us through WhatsApp group or through WhatsApp lah. Biasanya kita pakai teledentistry because I'm still developing the apps for the parents to use it. So ambil gambar, selalunya lah parents ambil gambar pakai handphone biasa, but you definitely have to try to expose as much as possible, so that we can help, at least give you a first aid, an immediate opinion, so that you know whether to come in, not to come in, or sometimes it's just an ulcer, kita boleh advise you pergi beli ni je ke, tak payah datang, because sometimes when you are concerned bringing them outside, also something that we need to look into lah. Kadang-kadang tak payah datang pun, we can give advice through WhatsApp group dan sebagainya. But to take a pictures, you have to have a good light. because we cannot do diagnosis if it's like some sort of, when you send us a picture, it looks like in a cave. Kan? Macam ambil gambar macam ni je. So try to have somebody hold the torchlight for you, and then you can snap. Or have your torchlight of the phone on when you take the photos. It's just to, really show us what is the problem.
So basically, you have to take the front teeth, the side, inside, open up.
Oh, you mean that you want to send the whole pictures of the mouth, is it? Or just the problematic area?
Maybe like because the parents didn't say, so maybe I assume that she asked what part to take. Like let's say, do you smile? Do you lift up the lips and take picture?
Yes,
okay.
darling. Yeah, thank you. So lift up the lip and then kena ada torchlight lah. You try your best to show as much as we can, because the first thing that we usually check first is actually the soft tissue or the places where the ulcers can be, and then the suruh cringe, smile the biggest you can, and then go inside, and macam I tunjuk tadi kat gambar, when you want to do brushing, you have to retract the cheek so that we can appreciate on the buccal side.
Okay. And then the most important thing is also lighting.
Correct. Okay. Lighting. Kalau boleh torchlight tu masuk dalam mulut so that reflects. Otherwise, if it's a blur photos and then macam we might end up saying something wrong. It looks like something, but it's actually nothing. It's just a reflection. So itu pun kita risau jugalah. Nanti kan kita cakap, ada benda lain pula.
Okay, so parents, like what Dr. Ilham say, lighting is important, as well as to pull up for the front teeth, pull up upper lips, lower lips, and the cheeks for the side, and then open the mouth to take the picture inside. But the most important thing is you have to have a clear lighting, so doctors can see. Right. All right. So while waiting for the question, I have a few questions that I collected from parents. Okay. So one of the things that question that I'm not sure whether it's sensitive, but I'm just going to ask anyway, since you're the pediatric dentist.
Right.
Some of the parents approach me, they ask, is dental care safe for during pregnancy?
Oh, self-care. I mean, for the pregnant mothers.
Yes, correct.
Yes, very important. Okay, because during pregnancy, there's a lot of fluctuation of hormones. Okay, so we also tend to eat more things like that, eat more sugary products because of the craving. But what I'm trying to emphasize is the hormonal changes. So with the hormonal changes, our gums elasticity change. So we usually develop this overgrowth of the gums. So they end up have a pseudo pockets. So there, when we eat so much, all right, when we eat, because we always have these notions that we ate for two, so we have to eat extra. So when we eat with the pseudo pocket happenings, so more food impacted there. So pregnant mothers, yes, they usually have this pregnancy gingivitis we call, or pregnancy epulis, because the gums and the hormones changes that change the morphology of the gums and make the food infections easier. And the brushings may be not as optimum because we don't usually, because previously kita tak ada that kind of gums, and then suddenly we develop, maybe we are not aware of, we should like go into it, or maybe do flossing more, for example, but it's just short-sighted perhaps, then that's what happens. More gums infection happens in pregnant mothers.
Right. And then is it safe for the mom to go for like to see dentist? Because I have parents who are concerned that
super safe.
Super safe. Okay.
Yeah.
All right. Okay. That's very
even do
good.
scaling, even do extraction. Usually for extraction, kita tak encourage for the first trimester, especially parents who are actually, expecting and then very prone to miscarriages. Sebab kan kalau if you are too anxious, you cram your body and you tend to give so much pressure on your body. Also, it's not something that we are really helping. So the first trimesters, usually we skip the extraction. All right, this is for extraction, cabut gigi. But coming to the second and third trimester, when the babies are already strong and the mothers are already strong, usually mothers towards the end kita dah strong kan, we know how to take care of our body, we can do extraction, no problem. But scaling as early as possible pun during the first trimester pun tak ada masalah. But for the mothers out there, mummies, you yourself know your bodies, you yourself know how much of stress that you can bear. For example, ada setengah orang memang ngilu sakit. Bila scaling tu dia ngilu, and then they started to give too much pressure and tense to their body. There is a cases of miscarriage punya signs. So as coming to pregnant mothers, we ourselves have to really understand our body. As long as you are fit and healthy, you can go through the process of seeing the dentist. You cannot be too anxious.
Yeah.
Everything kan, semua benda kalau takut pun dia akan jadi complicated kan, but
Correct.
super duper safe.
Yeah, correct. The reason why I say it's sensitive is because when these parents approach me, they're a first-time mother, so there's a lot of myth out there. So thank you for sharing your opinion, doctor. And another question I have from the parents, Dr. Ilham, do you attend to children with cleft dentistry problem?
Yes. Here in Faculty of Dentistry, we have another unit, oral surgery. We are devoted to cleft lip and palate children. So we do have with us and a very extremely experienced surgeons. So we have no, there's no limitations in our faculty because we are a very big faculties. We are actually the biggest dental faculty in Malaysia, the biggest numbers of specialists. So we come across cleft lip and palate and any sorts of other syndromes too. So if you are interested, please do come and have consultation with us. You go first to the oral surgery team and we work together with the pediatric teams. Because as you know, cleft lip and palate is a very long rehabilitation process starting from the born. So we are working together with oral surgeon. They do their cutting part, we do the preventive part.
Okay, all right. Another question I have about pregnancy is some parents are concerned about what they eat. So a parent approached me and asked, does parental nutrition affect the oral health during the pregnancy?
During pregnancy, yeah, true. Super duper agree. Okay, so whatever, again, I say, nutritionists can always emphasize, because we work also with nutritionists, whatever we eat becomes us, right? So during the pregnancies, definitely you need lots of vitamins and lots of supplements, because half of it, not just the food that we eat, but also the vitamins that we eat goes to the baby, especially the calcium. So I do come across parents mothers who started to losing their teeth due to pregnancies because lack of taking calcium. Because when calcium goes to the baby needs calcium for their bones and the tooth development. Because gigi susu terbentuk intrauterine at the 30th week when the babies are inside. So where does the calcium comes from? They curi calcium daripada mothers. So when they curi calcium from the mothers, calcium yang tinggal kat mothers untuk gigi dah habis. So mothers started to brittle the tooth, lose the tooth after pregnancies. I do come across lots of mother doctor sebab saya beranak ni habis cabut gigi saya.
Okay.
So the calcium needs to really top up. Aniline, lots of leafy vegetables, greens, where you can top up on the calcium part.
Okay, all right. So that's the pregnancy part now. Early childhood. I have some parents asking about caries. What is early childhood caries?
Okay.
ECC.
ECC. All right. Early childhood caries is a terminology that we use as a scientific terminology that happens in children less than 36 months. Okay, 6 years, more or less about that age lah, 5 years and below. Okay, where the caries is more than 2 caries. Okay, biasa kalau satu caries kita panggil caries je. When it started to become 2 or 3, it becomes multiple caries at a younger age, and the caries happens on the smooth surface caries. Where I mentioned just now, usually kita got caries on the posterior side, correct? But when you manage to get this part is actually very straightforward to brush. But yet again, that part also being affected by the caries,
So
by
is
the infection, by the acid attack. Okay, so the hallmark of ECC is actually anterior caries, because anterior caries ni daripada gigi canine sampai gigi canine, gigi taring sampai gigi taring, and as well as on the posterior teeth. Means that more than 2 caries is considered as a multiple caries, but the early childhood means it happens during the early childhood phase of that child before they become toddlers.
Okay, so is there any difference between caries and tooth decay, or is it the same thing?
It's the same. It's just a different terminology. Biasanya decay American yang guna.
Okay. All right, so that's early childhood, tooth decay or caries lah. Okay, and then a question whereby if the child, like the parents observe that the tooth or the teeth erupt at a very late age. Is it something to be is there something to be concerned about? Let's say some of them 18 months, 16 months, they start to see the teeth start erupting. But this particular parents say that 1 year old and it's still like very tiny, it's not coming out. Is it something to concern about?
All right. Good question. I feel like I'm being viva for my exam, Charlie. You punya question. Okay, going back to the question. All right, number one, yes, there is always a textbook when the tooth needs to come. The normal ones, and then is it accelerated, delay? So how delay is delay, how accelerated is accelerated. We have to know when is the right time to come. So macam Charlie kata 18 dah sepatutnya dah ada gigi kan. Okay, kalau lah accelerated, sometimes 11 months pun dah keluar dah. So 11 months, adakah parents akan concern kalau gigi keluar awal? Ataupun parents concern kalau keluar gigi lambat? Usually kalau keluar awal, kita tak concern. They will be very proud, macam jalan cepat, gigi cepat, cakap cepat kan. But when they start to become delay, then we are more concerned. Correct, that's usual. So when we know that by 18 months, dia patut keluar tapi tak keluar lagi, how delay is delay? Usually, by 1 year, kita belum consider as delay lah. It's slightly slow kita panggil. But delay ni, the word delay is a very huge word. It has to be very delay. So, one year plus to 2 years, I consider as delay. Okay, so usually katakanlah 18 months, patient datang dekat I belum keluar lagi. I cakap, okay, let's wait another 6 months. Because the first few phases maybe masalah. Some kids dia ada late bloomers, ada yang fast learners, sama juga dengan gigi. Dia pun ada late bloomers juga. But going to the mouth intraorally, we have to find out is there any factors that can contribute to the delay eruption. Nombor satu, mesti kena diet. Dietary is very important. That's why when masa baby tengah develop lagi, the diet of the pregnant mothers, the mothers expecting is very important because this is where is going to contribute to the development of the tooth. Because macam I cakap tadi, tooth develops intrauterine masa baby 30 minggu kat dalam perut, dia punya gigi susu. So if the mothers are not eating well, balanced diet, not enough sufficient calcium, gigi pun boleh lambat develop. Okay, nombor satu. Nombor dua, kalau baby sudah dilahirkan, postnatal, kita akan tengok dalam mulut, biasanya there's a situations where the gums are too thick. This is more of a genetic conditions. Kalau parents dia sometimes ada gummy smile, kan, dia ada too thick of gum. So when the gums are too thick for the tooth to penetrate, it's also taking time. Number tiga, is there anything that obstructing the tooth to come out? That is the pathological side. So kita akan tengok intraorally. Nombor satu, kita assess the age, how delay is delay. Nombor dua, okay, tak delay sangat. Nombor dua, then kita goes inside the mouth to rule out all these organic factors. So tiga tu tak ada obstructing, because usually we don't send patients babies to x-ray. The easiest way to find out gigi tu ada ke tak ada is just to take x-ray. But babies below 2, kita tak ambil x-ray because of the radiation. They just like, just coming to the world, breathing the air, suddenly we give radiation. It's not quite fair for them. So we usually don't send them for x-rays, but we do this kind of investigation. So usually we do palpations. We can see the ridges of the, usually when the tooth are ready to come out, the ridges become bulbous. The ridges become very like ada benda nak keluar, something like macam pokok nak tumbuh. So katakanlah macam tak ada, dia nampak macam shallow. So we know that there is no tooth pun. If it's a no tooth, then it's something different. Then we think of pathological. Is there anything that obstructing the tooth from comes out, or the tooth even not develop? There is a cases where there is no tooth pun. So contoh macam syndromic or patients who are actually congenitally missing. Dia tak develop pun masih intrauterine. So that is totally a different story to discuss. So yeah, that's it. That's it from me for that point. So whenever you come across these parents, yes, how delay is delay, and definitely we have to go check inside the mouth. So usually after 18 months, parents concerned tak keluar lagi, kita memang encourage datang to our clinic just to see whether is there any organic factors that are affecting the tooth punya eruption.
All right, just to rule out to see if there's other complication or other medical condition.
And then sometimes mothers dia tend to compare. Kalau bukan anak sulung dia concern. Bila anak kedua dia compare dengan abang. Kan? Anak ketiga dia compare abang adik. Walaupun datang dari ibu bapa yang sama, development can varies. Okay.
All right. Okay. Another question I have, very interesting. Parents say that the child experience in swallowing toothpaste, and then it's like the child explained that it's like a burning sensation around the throat. So how do you stop that? Like, they didn't say what type of toothpaste they're using, but they just say that now the child is no longer, it's like they are scared of brushing teeth because the toothpaste when they accidentally swallow it, it causes irritation on the throat. Because the parents said they search up Google, they try honey, milk, water, rice, but it doesn't stop the burning sensation.
Okay, right. Interesting question indeed. So, okay, first, if I come across this kind of patient, so first and foremost, how can you evaluate that the burning sensation? If I may know, what is the condition of the child?
Okay,
if the child is a DS ke, ASD ke, can the child really reasoning? I mean, how do you quantify that burning?
Yeah. Very good question.
Itu very articulate that she can say or he can say, I have a burning sensation. Even myself sometimes, burning ni kalau kita makan benda yang panas, kita pun kata burning. But burning here is very something specific, a very distinctive feelings. So how come this child can tell you, I have a burning sensation?
So this is, sorry, doctor. So I did ask the parent.
Right.
The father tried it himself.
What?
So
Sorry?
the father tried it and try swallow a bit, and that's where he's like, he understand why the child is like this. So when the father approached me, that's where he said it's a burning because the experience. So I was like, oh, okay.
He himself have that kind of burning sensation.
No, he tried after the child.
And then the father have a burning sensation.
Yeah. So
can it be that the father has burning sensation but the child does not?
I have no idea, but I think they assume that this child is experienced because crying non-stop after swallowing.
After swallowing.
So
right.
since like the child cannot really express,
right.
So that's where the father tried himself.
So I think the burning sensation is actually the father's word, not the child's word, if I may say that. Okay. Yes. So all right, that's kind of very interesting lah. So that when the parents tried it, how can you replicate the feeling on another party, another person's? But being myself as a parent, of course, I want to trust whatever my child says, right? Whatever my child's complain to me. Okay, going back, seriously talking, kalau burning sensations can really happen actually inside the mouth. There is actually a burning syndrome, kita panggil, where a person's, particularly where they have a very sensitive oral soft tissues and they have allergic to certain chemicals. Okay, it's not only can happen with toothpaste, but it can also happen with the mouthwash. For example, a prolonged use of mouthwash or a specific use of a brand where you have an allergic towards a specific chemicals. Okay, it causes you the thinning of your soft tissues that the burning sensation gives. Okay, that the burning sensation actually macam kalau kita termakan benda yang panas cepat pelan. In my opinion, that's how it feels because yes, we do have patients, actually usually adults patient, geriatric patients when the quality of the saliva reduces. When the patients have a very dry mouth, okay, they easily have allergic reactions to certain chemical. Ataupun the prolonged use of certain chemical. Contohnya dia baru cuba ubat gigi tu. Biasanya kita akan guna certain things yang very kuat, kita akan keep on beli benda yang sama. Suddenly mungkin benda tu dah tak ada, then you start buy new things. When our body is already, being familiar with certain chemicals, suddenly you change your chemicals, it can also give you burning sensation. Yeah. So coming back to the father's concern, number one, we have to identify why the child swallowed the toothpaste in the first place. Does he likes the taste? Does he enjoy the taste? Is the toothpaste Kodomo Lion orange taste? Okay, because I do have patients who actually really enjoyed mint. Suka sangat mint. So dia swallow lah. So kita kena tukar lah. So kita kena identify kenapa dia swallow on the first place. Not the burning sensation, but children should not be swallowing their toothpaste to begin with. Right? So why they are swallowing from the beginning? Kalau dia suka, dia tak boleh, kena change lah. So kenapa dia suka? Maybe the taste. Kalau dia ada taste, you kena beli tasteless toothpaste. Or whenever you do the activity of brushing, you yourself putting the toothpaste, simpan toothpaste, letak dalam laci, kunci, telan kunci. So dia tak boleh ambil toothpaste tu. You see what I'm trying to say here?
Great.
Jokingly, all right? The accessibility of the toothpaste is another story to tell, kan? To discuss. How come the child can access to the toothpaste and then eating on his own, enjoying like they are eating Oreos. Okay, and then if they likes, you have to find out kenapa like. Selalunya benda manis budak suka lah. And then mimpi. Certain budak dia suka because they very excited. There has a lot of sensory. Dia suka sapu-sapu. I do have patience. Dia suka that mint tu, dia beli paling kuat Darlie. Lepas tu dia suka buat macam dekat Winter Sonata. They have that, they like that kind of feeling. So dia pun end up makan Darlie tu. So how the accessibility to Darlie macam mana? So again, I think there's a lots of other confounding questions around it rather than the burning sensation itself. But yes, I'm not going to discount if the child really feels the burning sensation, maybe it's the allergic towards a certain chemical. So you try to use the same toothpaste with your child. Try not to change too much. Macam kita tukar sabun juga. Kadang-kadang kita pakai sabun ni okay. Lepas tu kita tukar. Hari tu tak ada stok. Beli yang lain sebab dah lambat. Tiba-tiba kita gatal. Same thing.
Okay. All right. So for the burn feel, how do you reduce? Because the parents say that they try honey, milk, it doesn't
How
work.
How long does it stay there? Because the moment that you did not eat it anymore, it should be like reducing. It's a self-limiting. It has to be self-limiting, but you have to get rid of the behavior.
Okay.
Or it has to be, maybe it is something. It can be tonsillitis, because when you say swallowing, what is go through the swallowing punya process? Your ileo go to the tonsil. Maybe the burning sensations come the tonsil. It's not that. Maybe the child has tonsillitis, or maybe the child has some lesions or luka dekat dia punya soft palate, epiglottis. The moment that we want to telan, kan ada the epiglottis there, to decide whether to go to trachea or to go to epiglottis untuk telan, kan? Sama ada kita nafas, we go to the SAM. Go to the tummy or go to the lungs. That part also can be very sensitive. Or normally in children, you have to check for their tonsillitis, because all food goes there, pass through tonsillitis. Kalau tonsillitis dia besar macam ni, you imagine that food goes in. Dia boleh friction also can. So a lot of confounding factors in these issues. So yet again, beside from the behavior of eating the toothpaste, we definitely have to go in and see what gives this sensation.
Okay. So coming to that,
kalau sakit juga, memang minum air je jawapan dia.
Okay.
Because anything to do with soft tissue, as long as you get rid of the factors, get rid of the problems, it reduces. It is a self-limiting process. Then dia thicken balik you punya tissue tu. Because anything that thin, body kita ni, our God really makes it set the perfect way. Bila dia thinning, you get rid of the problems, it started to thicken. So when it started to thicken, you should not be feeling this feeling anymore unless you are keep eating it. So it becomes thinning, never thicken.
Okay. So, all right. So coming to this, is it safe for the child to swallow?
It's not safe. We should not allow child to eat toothpaste. I hope I get this message across. So we have to definitely control. Sometimes kids try to pull our legs. Letak dulu. Kalau tak nak bros. Okay, ni letak je. I mean, it started with practice. When they know that this is the only amount. But the moment usually this happens when we give the responsibility for them. Yes, correct. We want them to do it on their own. Takkan hari-hari pun mama nak kena juga letak. So that's when they started to become creative. Kan, dia letak sendiri. But now we do have a lot of things that help. Kita ada toothpaste dispenser. So where that you can control. So yes, a little bit of investment can help this kind of situations. Otherwise, memang kena ada orang yang letak lah hari-hari bantu, so that they're not going to end up eating it and enjoying the toothpaste rather than brushing.
All right. Okay, so we are already at the end of the workshop. One last questions that I have is, when do you start introducing mouthwash?
Mouthwash. Mouthwash is very highly indicative. Only when you have a problem, then you use a mouthwash. From adults, regardless of conditions. So mouthwash ni biasanya we give it when you have a problem with not the tooth, is the gums. Tooth memang brushing. You cannot get away with not brushing tapi nak guna mouthwash. So mouthwash is actually when you have a gums infection, okay, when you have ulcers, something to do with the soft tissue, then you use. But maximum you can use only 2 weeks. Longer than that, then it comes with the burning syndrome because it start to thinning your other soft tissues. Kita punya soft tissues dalam ni very sensitive, but God make it like asal dia nipis dia menebal, asal nipis tebal. But when you keep on, when we are trying to lawan that kind of physiological changes, then when the problems comes in. So using of mouthwash highly indicative. If you are not prescribed, don't use it. It's not a daily basis use. Daily basis is toothbrush. Flossing, yes, you can use it daily basis, but not mouthwash. And then use it not more than 2 weeks. Usually, for us dentists, for patients who have chronic perio, gums problem, ada abscess, mulut berbau, kita akan bagi sampai 2 minggu saja. After then that, go back to brushing.
All right. Okay. Thank you, doctor. So, okay, for parents out there, sorry, we are already at the end of our Facebook Live. If you have any questions that I cannot answer, you can find Dr. Ilham from UITM. Okay, you can search Dr. Ilham UITM, and you can email her, like she said just now. She's okay. If you want to make an appointment to see her at the clinic, or you just want to have a chat, feel free to email her because we're already at the end, so I cannot. Dr. Ilham is a busy person, so I cannot take more of her time. Okay, and then like I said, the reason why we do this workshop is to create awareness. As me and Dr. Ilham, we experience whereby we learn a lot from parents, but at the same time, we also try to guide parents in the right pathway to look for the right professionals, especially when it comes to oral health and children with special needs in specific. So like Dr. Ilham said, in summary, any pediatric dentist, they will see a child from 0 to 16. Okay, it's regulated, it's a standard across Malaysia. And just look for pediatric dentists if you're looking for one, if your child is below 16. And then if you look for and in particular children with special need, Dr. Ilham did share the term as well. It's called special care pediatric dentist, or pediatric dentist special care. Okay, so that's the keyword you can search in Google. So you know what to do and where to go when your child having difficulty, or you suspect or you assume that your child has, or you find that it's been a while since you check their teeth, or it's been a while since you practice oral hygiene. So these are the person you can go to. Okay, and please do check out oral health once in a while, or maybe on a, like Dr. Ilham said, if your child has difficulty opening their mouth on a daily basis, if can, we have to try to make sure that the oral health are well taken care of and it's not neglected. Okay, all right. So thank you, everyone. Thank you very much, Dr. Ilham, for
my pleasure,
joining us today. And it's a very good sharing where I still have a lot of questions, but I'll keep collecting until the next time because there's a lot. I met parents on a daily basis. There's a lot of questions. Maybe they're a bit shy to share on Facebook comment, but yeah, there's a lot more, but we can't extend the time anymore. So if you have any question, feel free to email her. You can just type Dr. Ilham. I don't think there's more than 1 or 2 Dr. Ilham in UITM. I think there's only one. Right? Okay. Thank you so much, Dr. Ilham. And it's really good sharing. And to be honest, I myself learned a lot about like the step of brushing, behavior management. There's a lot of things that we can accommodate, not just, it's in a way that parents teach us to be flexible in terms of handling children with special needs. Like you said also, doctor, all the kids can have ASD, but they have a different way of behaving.
Correct.
All right. Thank you so much, doctor. Thank you, everyone.
Have a nice weekend, everyone. Take care. Stay safe. Bye.
Bye.